Welcome back. It is 11:45, and in about 15 minutes at noon, healthcare providers throughout Texas are going to be observing 5 minutes of silence to honor the 56,000 Texans who've died from COVID-19 and also to reflect on battling the virus together for 18 months and counting. It's been a tough ride, to say the least, and one of the latest challenges that doctors are seeing is over a drug named Ivermectin. So the FDA has been issuing alerts about this because people are taking doses intended for livestock in order to treat COVID-19. And also, Joe Rogan told his 13 million followers this week that he is taking it among some other things. But doctors, the FDA, the CDC, they want to be clear. There is no evidence that Ivermectin is an effective treatment against COVID-19. But still, there are a lot of questions, starting with what exactly is it? Well, we have a doctor in right now. So joining us live is Dr. Gregory Yu, a physician at UT Health San Antonio. Thank you so much for joining us.
Thank you for having me.
Absolutely. You know, the pandemic has proven to be very fertile ground for misinformation. So ivermectin, it is FDA approved, but not for COVID-19. So what exactly is it, and when is it safe for human use?
Right. Ivermectin is an anti-parasitic. It is FDA approved for the treatment of certain intestinal worms and other parasitic infections. It's also used for severe scabies and lice, but not typically used for viral infections.
Yeah, and the other issue, kind of the bigger issue that the FDA is warning about, is that people have started taking doses that are intended for livestock, for horses and whatnot, and ERs are filling up with people overdosing on it now. So is this something that you're seeing in local ERs? And also, please explain why it is just so dangerous to take the livestock version.
Right. So the livestock version sometimes is many times the adult dose. What I have right here, this is 10 ml, and this small amount is actually 7 times the adult dose. One of our colleagues, Dr. Varney, who is the director of the Poison Center, has seen a drastic increase in ivermectin calls. And so when this is taken at higher than study levels, and even at these toxic levels, this can lead to severe diarrhea, severe dehydration, and even possibly liver failure.
Wow. You know, the American Medical Association has come out with a statement. Of course, the CDC, the FDA, everyone not recommending taking this to treat COVID, definitely not the one that's intended for livestock. Yet there are also doctors who are prescribing it. It's hard to kind of make sense of it. Why are some doctors prescribing it?
I think maybe some physicians and patients, they are just looking for anything to combat this deadly virus. Ivermectin does kill viruses in a lab, but this doesn't always translate to humans. There were some earlier research many months ago and even last year that were poor quality with a very small number of patients that may have suggested some positive findings, but the most current evidence suggests that ivermectin is not effective for the prevention or treatment of COVID-19, which is why most of the medical societies have recommended against the use.
Okay, and I mean, I would have to safely assume that, you know, if I were to get COVID, I would want to try just about anything. So what treatments are recommended?
So there's very limited data on a lot of these medications or vitamins that you are hearing about. The number one thing that we tell people to do is to treat the symptoms. Since COVID-19 is a viral infection, many people, I would say most people, would actually fight the virus with their own body. The best evidence for anything is actually the COVID vaccine. The vast majority of people that are on ventilators, as well as people that die from COVID-19, are unvaccinated. And the risk factors, especially people that are obese, have diabetes, immunocompromised, those are the people that really need to get the vaccine.
Mm-hmm. And then Regeneron is available in our city as well. So that is an option that does have endorsements behind it. But Dr. Gregory Yu, thank you so much. And we'll be thinking of you. I know it's been a long journey, so thank you so much for all the work that you've already done throughout the pandemic.
Thank you very much for having me.
Absolutely.